Hello everyone, welcome to my channel Physio. So we start a new series which is biomechanics in our physiotherapy, which is most important topic, and it is clinical practice and the research aspect, which is very important for every physiotherapy aspirant. So what is the meaning of biomechanics? Let's differentiate about that. Bio, it means biological or human beings or any kind of animal living beings. Mechanics of their mechanism to perform different activity like running, jogging, walking, and different kind of activities is a coordinated, balance, or into the like normal way are occur or not. So that is the meaning of biomechanics, and this is the introductory part of the biomechanics. So let's discuss about that. So it is the mechanical principle of the living organism, especially human. So in biomechanics, we are studying especially human beings because if biomechanics is disbalanced, so human is to be not able to perform different activity like running and jogging. It combines principle of physics and physiology. What is that meaning? Physics, it means the mechanical movement with the particular angle or particular like axis, it will be occur or not. What is the physiology? The different kind of bodies function like respiratory, cardiovascular system, it occur or no coordinated or balance on particular angle, it will be happen or not to analyze how force innervated with the body. So the force has to be occur in our body like gravitational force or into water like fluid force or like different kind of force present in our surrounding. So in their forces, our body is maintaining their normal balance, coordination, their proper physiology movement as occur or not. So that is the meaning of biomechanics. What is the principle of biomechanics? So biomechanics is based on the particular principle. The key principle is such as force, which is a pull or push particular object of the motion. If I'm pulling and forcing some object, it will be displaced from one place to another place as to be motion to perform different activities like flexion and extension of the shoulder or different kind of activities like torque of the rotational movement. Their axis is to be present in the shoulder and the movement is to be circumduction, it will be happening without shoulder joint. Next is to be equilibrium. Our body is to be maintain the equilibrium like balance and base of support, and the center of gravity is to be present or not. It will be shifted into the navel area, so it will displace our balance. Next is to be equilibrium. This principle helps to analyze movement and designing the rehabilitation program. If in this 3 and 4 kind of principle has to be this balance of the particular person, so on that time this biomechanics help to study of the particular principles and analyze the particular movement of the person or the patient, and we are designing the rehab protocol for the patient, treatment protocol for the strengthening of the muscle, for the great training, and to the range of motion exercises or any other strengthening exercises protocol. So that is the principle of the biomechanics, which is very important. You can write in university examination. So why biomechanics is matter? So let's discuss. We have a 4 point. Let's discuss one by one why it is important. Biomechanics we are studying as a physiotherapist in our university as a medical field. So find the root cause. So basically, in a body, a human body. So if pain in one area like knee, or comes from the problem somewhere else like hip or foot. So take one example. If a person have a complaining their pain in knee joint, so we are have some tests to identify what is exactly pain root is to be occurring on the knee, like osteoarthritis or like bursitis or like inflammation is to be occur out there, or somehow any other radiating pain cause the knee pain like sciatica pain. So somehow somewhere comes is from up foot pain. If patients have complaining the knee pain, so we are also checking the foot. If they have person have flat foot, so also they have biomechanics has to be disbalanced and center of gravity base of support has to be totally disbalanced. So on that time their posture has to be disbalanced and the pain occur in knee and hip joint. Also the hip joint problem like compressing of the sciatica or also the tightness of the piriformis muscle, so also cause the knee pain and calf pain. So the root cause we have identified in the biomechanics study of the particular patient body. So this is very essential biomechanics for the study the root cause. Second one is improve recovery. It means a biomechanics identify root cause, and after that The therapist help to design the exercise that reveal the strength of the particular patient. So this is the patient have complaining the knee pain, or we have identified they have flat feet, so their body structure has to be changed and their gait pattern also have changed. So therapist or a doctor have ready to start the rehab protocol, or like great training exercises, strengthening exercises, stretching exercises, home activity to we have the particular patient, and short-term goal is to be remove the pain immediately, so it will be help to improve recovery. Third one is prevent future harm. What is that meaning? It means fix faulty movement pattern during running, walking, or lifting before any lifting any object before cause chronic damage. So if patient have come to you, I have like a work in a factory, and we have a heavy workload, or like lifting a very heavy object. So they have no pain, but he will be come with you for as a strengthening their particular muscle. So you as a as a physiotherapy, you have to work in a gym. So you have suggest some exercises to the particular person to strengthen their calf muscle, glute muscle, thigh muscle, abdomen muscle, back muscle, to strengthen, to improve the flexibility and strengthen to particular hold the object, hold the heavy object, and move or displace to particular here to there. So it will be not, if a person have to strengthen their muscle in previously, so after that time in the long duration of the work, there have to be not any kind of chances to cause like this bulging, this herniation, sleep, this kind of problem, it will be occur. Or that is the meaning of the prevention of the future harm. Last one is guide treatment choices. It means direct the use of principle of the correct posture and the gait balance issue settling. What is that meaning? All of the three matters of the principle of the biomechanics, we have to be easily identify what exactly happened in the patient body. If patient have like knee pain and their flat feet, also their gait pattern has to be disbalanced. So we have to be work to the gait pattern first. Second one is also we have identified or observed the patient posture also have to be incorrect. So we have also the check the patient limb length discrepancy has to be occur or not. So on that time measuring the limb length or correct over there for stretching the muscle one side and strengthening the one side muscle. So that is the treatment guide. Or also the, if patient have to be treatable by the manually rather than in the electrotherapy, so we have to suggest them or advise them to, you have to be treated by the manually rather than you have to choose the electrotherapy, which is a long term exposure cause the harmful effect in the minimal or into the old age. You have to be choose the manual therapy for strengthening your muscle. So we have recommended, then after we have studied the biomechanics, which is very essential for every physiotherapy aspirant. So that is the introductory part of the biomechanics. Make sure you have to be make a diagram before writing the biomechanic answer into the university examination. Thank you.